Everyone, my name is Jean Rowe, nurse practitioner. I'm very happy to have this opportunity to talk with you. I'm thrilled that you've joined the group here, and I hope you will enjoy being part of this group. I hope you'll participate. I would like to hear your concerns, your interest, your successes. That would be great to hear too. Questions, we'll exchange questions and conversation with each other and try to make this a nice experience for all of us to learn more so we can optimize health for our patients. I started the group so we could have this kind of open forum because I am definitely have leaned for many, many years to helping people to overcome symptoms in ways that may not necessarily require medications, but help them with lifestyle changes, help them with other remedies, diet, lifestyle, especially dietary work, but other internal work maybe, just some coaching a little bit about how to become more healthy. So I'll tell you more about my background. It might give you some idea what I'm talking about. I'm kind of one of these people who will try their very best. I'll go to kind of great extremes to learn something if I think it's going to help my patients. So this started back in the 80s. I graduated in nurse practitioner education, and I've been a nurse practitioner for over 30 years, like I think maybe before some of you were born, and I did my work in women's health from the University of Colorado, which was a great program. It was wonderful. And I came out of there and got a position with two OBGYNs in the Denver area, two women OBGYNs, which was very unique at that time because women, there were only, I think there were 3 female GYNs in Denver at that time who gotten through the residency program at CU, University of Colorado. So we've come a long way since then. Then the nurse practitioner programs have flourished too. That was where the first nurse practitioner program started, was at the University of Colorado. So I came out and began working with them, and they had sort of an interest in how to help people who were unwell too. They didn't always want to go to medications. We of course use medications. We use traditional treatments when it really makes total sense. But they were interested in helping people become more whole in terms of caring about the mind, the body, the psyche, the spirit. So it was great for me to start out that way with them. I needed it too because at that time I was in my 30s and I had all my life horrid depression and not successfully treated depression. It would flare so badly in the 2 weeks before my period that it was a nightmare, seriously a nightmare. It was an out of control kind of feeling. And I would hear that from my patients as well. And so it was just devastating to me that I couldn't get past it. And I did so many different types of therapy, some I wouldn't even describe to you, and so many different medications, as I said, and supplements and diets and every spiritual path you could probably imagine, just looking for answers, looking for how can I change this brain. So interestingly, in the last year, I've learned a lot about changing this brain, and I'm going to be sharing that with you in time too. And I'll tell you how you can read a little more about that and contact me about it if you want to. But back to the PMS story, I said to just one day, I remember standing in the hall talking to one of my employers, and I said, I want to start a PMS clinic. Do you want to do it with me? And she said, sure. She was like a pioneer like I was. She was, sure, let's go for it. So we did. I went down, literally at the end of that day, I went down to the office of the manager of this medical complex we were in and said, do you have an office that we can use and rent? And he said, a little one? And he said, sure, right here. It was by this little pharmacy. And so we just opened the doors. And shortly after we opened the doors, there was one of the local talk shows for women in the late afternoon, put our name across the screen, this banner running across the screen with our name and phone number. And oh my word, the response was absolutely amazing. It was sad in a way that there were so many women out there who just felt desperate like I did. So many of the women who came to us at first were people who had psychiatric illnesses. They just were hoping that we could help them. They were hoping they had PMS because the drugs at that time weren't good. They were very hard drugs to manage for patients and doctors and nurse practitioners, I'm sure. So Um, so we got all these people in our clinic, and we had a 4-page history of symptoms for them to fill out. I mean, some of them were full. The pages were full. It was just like so heartbreaking, and I just wanted to help them. And I'm thinking, what do I know about this? All I knew was there was a doctor in England that started treating PMS in 1953 with natural progesterone. Thank God for her, because that made a big difference for some people. We just started using that right away. Our little pharmacist outside our door, at the pharmacy outside our door, started making natural progesterone in suppository form that women would use, or oral capsules. So we started to use it then, back in the 80s. And with some help, it was especially helpful, because progesterone is calming. It was especially helpful for women who had the rage type PMS. But we couldn't help everybody that way with this 4 pages of symptoms. They were obviously the walking unwell, literally the walking unwell, and they needed to be helped. And we called in, of course, other specialists as we needed to. However, we gave our usual array of supplements that you could give back then that anybody knew anything about, which was B6, essential fatty acids, magnesium. So one day I was reading a medical journal, the Green Journal, which is, the regular OBGYN journal, and a doc from Texas, a small town in Texas, said he was doing progesterone neutralization, which was like kind of neutralizing the effect of progesterone in the body with his homeopathic little shots. I know it sounds weird, but I was all ears. And I called him. He told me about it. We wound up doing that with some of our patients, which was helpful to many of them. But he told me if I was going to treat PMS, I needed to treat Candida yeast overload. And I had never even heard of Candida yeast overload. All I knew about was Candida vaginal infections, which I certainly knew how to treat. But he told us about this, and we got this history form, because he sort of told us what symptoms to look for, and it fit our patients to a T. I mean, it was just shocking how many symptoms of Candida these patients had in their big histories. And so you will think of it as causing systemic symptoms, however, except in a blood infection or something, of course. However, Candida grows on all mucous membranes, as you know. It can grow in mouth, nose, sinus, esophagus, stomach, bowel, and it can grow on bladder, skin. So we wondered how could that be, and then there was these pioneers, Dr. Ryan Truss and Dr. William Crook, who really were digging into the Candida in other parts of the country in writing. And I'm going to attach in my other page and this page an article by Dr. Truss, which is just really precious to see what he did back then, and took great flack for, as did we, doing this work. Still, doctors don't believe it. I thought everyone would believe in it by 5 years later. Still, they call it quackery. I still treat people. I've treated thousands of women for Candida overload. It's overload and allergy, which I'll explain another time. The main symptoms that we would look for were, one of the biggest ones was sugar cravings and carb cravings. So that I got to the point where I could almost figure out they had it by asking those questions, like which foods would be the hardest for you to give up, which is kind of a cruel question in a way, because that's what I was going for, and what's your antibiotic history like. And very, very often there were young women who'd taken antibiotics for acne for some spell, or chronic bladder infections or something. The histories just fit to a T. I'm not saying Candida was their only problem. I'm not saying Candida is anybody's only problem now. But I will say that what I've learned in doing this kind of work is you want to address the total load on the system. And sometimes if you go after the biggest load on the system first, you can get a lot of relief for people. And it's just so welcome to them. It empowers them then when they're feeling somewhat more well to go further, to begin to be able to do lifestyle changes, be able to focus. They get sleep finally. They sleep well. They feel better. They don't feel depressed. They don't feel toxic. It just is a wonderful thing to do, to sort of look at that total load on the system and think, what's the biggest thing I can take off this, or help this person take off their system? And that's how Candida has really functioned for many, 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 many of my patients. So I'd like to talk to you more about this, and I would like to share further information over the next maybe couple videos, and I'd welcome your questions on this site, or my other site is Exquisite Aging International, and that's where you can see some of the stuff I've been doing in the last year as well. So Exquisite Aging International is a Facebook page, so it's a, and this group here, we can certainly share all the information and questions you want, and I really look forward to our discussions, and I thank you for paying attention to this video.